Okay, so I think we can start this Vielight provided webinar series on brain recovery using photobiomodulation. Hi, everyone. Welcome. Thank you so much for attending. My name is Nazanin Hossein-Kha. I am the Director of Special Projects at Vielight. I am the co-host. Along with me is Austin Ganesh, who is the Marketing Manager and Conference Manager. The two of us will be hosting this webinar today, and please send any questions you have on the chat, and we would moderate that. Just a quick housekeeping note that please mute your microphone during the talks. And we would have a Q&A session right after each presentation that we have, so we could address all those questions that are upcoming. So we are very excited for you. We are very thrilled to have you as our audience from, I guess, pretty much all around the world. I am honored to introduce two distinguished speakers today. Dr. Jenna Alojas-Warren. Jenna, for short, is my best friend, and she is a highly experienced neuroscientist with training in various forms of brain stimulation. She obtained her PhD from University of Toronto and has worked for Vielight for nearly a decade so far, studying on the effects of photobiomodulation on brain, exploring its various clinical applications. She leads the design and execution of many of the clinical trials at Vielight. With a strong background in scientific communications, she has contributed to numerous peer-reviewed publications, book chapters, and conference presentations. So after Jenna, who will give a talk about the science-based aspect of brain recovery, we will move on to Penny Jean Gracefire. She is a well-known practitioner in the field of neurofeedback. She is the neural frequency analyst. She's a licensed mental health clinician, and she has been a well-known published author. She specializes in designing therapeutic applications for emerging neurotechnology, constructing closed-loop EEG-based feedback paradigms to alter neural dynamics in real time. Her groundbreaking work has led to industry-led changes in neuromodulation and is the basis for current standards in international certifications. So we are very honored to have those two distinguished speakers here with us. After Penny Jean's talk in the agenda today, I will take on and talk about our state-of-the-art, I guess, the most advanced photobiomodulation device that is highly customizable in the field, and Vielight just recently launched, which would be the NeuroPro 2 device. And following that, Austin Ganesh will talk about some of the Vielight affiliate programs that we do have right now, if you're interested to learn more. On this webinar, we have a discount code for VR 2025 that you would get 10% off on all of our devices except for the NeuroPro 2 device. So with that, I would like to welcome Jenna. Jenna, you can go ahead, take it away, share your screen.
Hello, everyone. Yeah, give me 1 second as I pull up my slides here. Just making sure that this is the correct version. Okay. Good afternoon, everyone. Can you all hear me okay? Yeah, okay, great. As Nat said, my name is Dr. Jenna Alojas-Warren. I am a neuroscientist, and I am the Senior Manager of Research at Vielight. Just going to start off with some quick disclosures. So I am an employee of Vielight, and Vielight is the developer and manufacturer of photobiomodulation devices. Vielight devices are categorized as low-risk general wellness devices by the FDA. So they have not been cleared by the FDA for any medical indications yet. However, our Vielight RX Plus has been approved by Health Canada as a treatment for acute COVID-19. And then this approval was later expanded to upper respiratory illnesses in general. And then our Vielight Relief device, which is intended to treat focal pain, is registered with the FDA as well. So at Vielight, we primarily focus on brain photobiomodulation. So our devices are mostly intended for at-home use, but they are offered by many practitioners. They are offered by many practitioners and clinicians as in-clinic treatments. So our most popular brain photobiomodulation device is pictured here. This is our Vielight Neuro. And the Neuro delivers near-infrared light, both transcranially and intranasally. So we have 3 models of the Neuro available. There's the Neuro Alpha, which delivers the near-infrared light pulsed at a 10 hertz frequency. We have the Neuro Gamma, which delivers the same light but pulsed at a 40 hertz frequency. And then more recently, we have the Neuro Duo, which is able to deliver both the alpha and gamma stimulation. So you're able to toggle between whether the light is pulsed at 10 hertz or 40 hertz. And what we've generally seen is that with the 10 hertz stimulation, it tends to help with things like stress reduction and sleep. Whereas with the 40 hertz helps with things associated with cognition, so focus, better memory, mental clarity, and brain energy. But I think this is, this is just the beginning of the picture, and we're learning a lot more about the pulse frequencies through our research. So the benefits of incorporating or using brain photobiomodulation, firstly, it's non-invasive. So compared to other forms of brain stimulation, you don't feel anything when using brain photobiomodulation. It's not painful and it's effective. So I will be going through research showing its effectiveness for various applications. It's also a non-drug option. And as I mentioned, it's a general wellness device, which means that you don't need a prescription to use the device. And lastly, it's great as a main therapy, but also can be used as an adjunct therapy. So the benefits of photobiomodulation to the brain are quite broad, and we've investigated a lot of clinical applications. Now, one of our most promising areas of research our therapeutic application has been for traumatic brain injuries and concussions. So we have a large body of evidence, and it continues to grow, showing that brain photobiomodulation can speed the recovery from brain injury and concussions. And more recently, we're seeing research from our devices, not yet published, that it can even maybe prevent prophylactically head injuries in athletes when they have these repetitive head acceleration events. So these treatments can be, as I said earlier, can be offered through in-clinic treatments. Some clinicians or practitioners will offer them as device rentals where patients can rent the devices, and then the intranasal diodes can be purchased separately. And they can also be offered through clinics as a part of some sort of wellness program. So we, as Naz mentioned, we do have affiliate and distributor programs available, and I'll be going through those at the end of my presentation. So again, this is our Neuro device. So it has 5 transcranial diodes as well as 1 intranasal diode. Our headsets have a adjustable design that allows for the LEDs, for you to adjust so that the LEDs have good contact with the scalp. And we have seen through our research that it's very important for us to have that good contact with the scalp. So our transcranial diodes are targeted at the default mode network. So the default mode network consists of these regions on this slide here. Now, the default mode network is a network in the brain that lights up when the brain's at rest. So it's when it's not involved in some sort of external task. So it's most active if someone is daydreaming, mind wandering, introspecting. That's when you see the default mode network really active. So the proper functioning of the default mode network is important for things like memory, memory consolidation, emotional regulation, and future planning. And dysfunction of the default mode network is actually seen in many mental health disorders and brain illnesses. So it's seen, for example, in depression, in anxiety, in schizophrenia. And impaired connectivity of the default mode network is seen in many TBIs as well, and in ADHD. So targeting the default mode network using brain photobiomodulation may help optimize healthy brain function and also regulate impairments seen in various brain conditions. Now, the fifth LED is at the back of the head, and it's targeted at the cerebellum. And we've also seen that targeting this region may help with glymphatic drainage. And glymphatic drainage is the way that the brain removes toxins or debris from the brain. So it's a system for removing toxins and debris for the brain, from the brain. So in addition to our neuro devices, we also have devices that are just meant for intranasal light delivery. So pictured here is our MIP. And we have both internal EEG studies as well as independent fMRI studies conducted at Baycrest Hospital that demonstrate that the intranasal light itself produces a strong brain response. So it is a powerful device on its own as well. So our MIP is available in different models. It is available with the 810 nanometer diode, which is meant for brain stimulation, so targeting the brain, and that can be pulsed at either 10 hertz or 40 hertz as well. It also has these red diodes, so 655 nanometer laser diodes or 633 nanometer LEDs meant for targeting the blood. So this is for blood irradiation. And then we also now have the 470 nanometer, which is a blue light, and that's antimicrobial. So it can actually kill microbes in the nose before they cause an infection. So we have MIP devices that have different combinations of these diodes, and you can see that on our website. So these are the various areas where our devices are currently being used for neurorehabilitation. So the ones with the red asterisks are areas where we currently have clinical trials ongoing, or we have completed clinical trials. So one of the most common questions we get asked at Vielight is the light able to penetrate the skull? So we've done quite a lot of brain imaging work ourselves, and it's also been done independently by various universities and hospitals. So we've seen through EEG and fMRI work that that the active stimulation is able to modulate brain activity. So when we do these studies, we also use a sham device quite often. So a sham is an inactive device that allows us to compare the difference of active stimulation with our devices to an inactive stimulation to see the differences. And we do see strong differences produced by active stimulation. So at Vielight, we have the Brain Research Lab where we conduct EEG studies. And again, there we study the effects of our devices on brain activity, and we conduct sham control studies to see the differences there. And we also do it in healthy individuals and various patient populations.
I think we have a technical issue. Jenna, your screen just froze 1 second.
And no sound.
Yes.
Yeah, thanks. Yeah, we'll try to just troubleshoot this. Sorry, everybody, for this technical issue.
bear with us 1 minute.
We can see your screen again, Jenna, but you might need to take
Okay.
yourself off mute.
I'm unmuted now. Can you hear me?
Yes,
Excellent.
that's perfect.
Perfect. Sorry about that, guys. I thought I was still connected to you, but I was not. Got kicked right off. Okay. Give me just 1 second. I believe I was here. Okay. Let me just see where, yeah. So what we saw in this study, all good? Yes, okay. So what we saw in this study, this was again in healthy older adults. What we saw was that with the neurogamma stimulation, there was an increase in power in the faster brain waves. So in beta, gamma, alpha, we saw an increase in power, whereas we saw a decrease in power in delta, theta, so the slower brain waves. So this shows us that stimulation with our device acts on brain oscillations in the brain. And interestingly, for example, in certain patient populations, such as patients with Alzheimer's disease, normally what you see is a decrease in power of these faster brain waves and in high power in the slow brain waves. So for conditions like that, this gamma stimulation may be able to counteract the impairments or aberrancies seen in brain oscillations. So there have also been fMRI studies done with our devices at University of Southern California, and more recently, we have ongoing studies at Baycrest Hospital here in Toronto, and they're studying the effects of brain photobiomodulation on cerebral blood flow and oxygenation. So generally what we're seeing from our fMRI studies is that active stimulation produces an increase in cerebral blood flow. It improves cerebral spinal fluid flow or lymphatic flow. And now we see changes in the BOLD signal. So the BOLD is blood oxygen level dependent imaging. So there are a number of broad groups of clinical applications for brain photobiomodulation. Our devices have shown effectiveness in neurodegenerative diseases. So this is MCI, Alzheimer's disease, Parkinson's disease. There's also research published using our devices showing positive effects for neurodevelopmental disorders. So these include ADHD and autism. There's work been done in neurological conditions, so stroke, and as I mentioned, a lot of work in brain injury. We currently have a study going on at Vielight. It's just started for patients with major depressive disorder, and Queen's University is about to launch a study using our devices for using the neurogamma specifically for bipolar depression. And as I mentioned earlier, our RX Plus is already approved as a treatment for upper respiratory illnesses and COVID-19. So there have been a number of brain imaging studies completed over the years using Vielight devices that have shown that transcranial photobiomodulation produces changes in cerebral blood flow, in brain connectivity, and brain activity. So this was a study done by Dr. Linda Chow from the University of Southern California. And this study was done in 8 patients with mild to moderate dementia. So they were administered the neurogamma for 12 weeks. So they had 20-minute sessions 3 times a week for 12 weeks. So after those 12 weeks, they saw improvements in cognitive function, as well as increased cerebral blood perfusion and increased connectivity between the modes of the default mode network. So while this research has been done in patients with dementia, the changes we see with these devices in terms of increased cerebral blood perfusion and improving connectivity in the default mode network are also relevant for other brain conditions, such as traumatic brain injuries and post-concussion syndrome. And actually, very similar protocols have been used for the treatment of TBI as well, with good results. So this was a study recently done using our Vielight RX Gamma for the treatment of post-COVID cognitive impairment. So this was done again with 43 participants who met the WHO definition for post-COVID and had a documented COVID infection. So after 8 weeks of treatment with the neurogamma, again, this was 20-minute sessions, 6 days per week. So 1 session per day for 6 days per week. And we looked at cognitive performance. So what we saw in this study was that there was a significant improvement in the active treatment group compared to sham in the cognitive composite score. So this was the domains of improvement included executive function, working memory, visual spatial processing, attention, and episodic memory. Now, this is some of the preliminary data from Baycrest Hospital looking at the effects of brain photobiomodulation on cerebral blood flow. So the main take-home, I mean, we're still waiting for the full data set to be analyzed and published, but the main takeaway of the preliminary data we've seen so far is that even just the intranasal alone or frontal stimulation alone is able to produce a rapid and global response, change in increased blood perfusion. Again, this is preliminary results from the Baycrest study. So some other interesting things that are coming out of this study is that we're learning that parameters matter. So whether it's wavelength, power density, pulse frequency, or mode of light delivery, so whether it's transcranial or intranasal, all these matter in terms of the brain response we see. And one other thing I'd like to highlight again is this graph here demonstrates how powerful intranasal stimulation is. So to produce a bold response, a similar bold response to 150 milliwatts per centimeter squared of transcranial light delivery, you get a similar bold response with 9 milliwatts per centimeter squared of intranasal light delivery. So they both produce increases in the bold response, but the difference in power. So because this is intranasal, you can achieve a similar response with less power. So we've also had some work done at the University of Alberta to learn more about pulse frequencies. So we've already seen with some of our EEG work that pulse frequency matters, that it can impact brain activity. But interestingly, now we're also learning that it can produce changes at the level of microtubules. So pulse frequency, depending on the pulse frequency, you get different changes at the level of microtubules. So we've learned that 10 hertz stimulation, so 10 hertz photobiomodulation, causes an instability of microtubule secondary structures. So what does this mean? This allows for microtubules to refresh themselves. So basically what we're seeing is that the 10 hertz pulsing causes a transitioning in microtubule substructures, suggesting that 10 hertz pulsing might prime the brain for then other treatments, whether it's with 40 hertz or other treatments. So the 40 hertz has actually been shown to be more consolidating or producing polymerization, whereas the 10 hertz produces instability in microtubule substructures. So pulse frequency, again, even at the level of microtubules, seems to matter. So this is another case of a 23-year-old hockey player with a history of concussion. So he self-administered photobiomodulation at home with alternating with treatment with the neurogamma and the neuroalpha. And after 8 weeks of treatment, he experienced improvements in cognitive function. But what was interesting about this case is that they also saw a change in gray matter volume. So there was increases in gray matter volume, suggesting that there was neurogenesis following his treatment with photobiomodulation. And in this subject, they also saw again an increase in cerebral blood perfusion and changes in functional connectivity. And I'd like to highlight also that this is not the only time we've seen changes in brain volume following the use of PBM. It's also been seen in some of our TBI, other TBI. So the VA has now approved photobiomodulation as a treatment for TBI, which is good news. So a lot of our work in the space of traumatic brain injuries and concussions has been done independently by the University of Utah. So they have a lot of data and publications in press right now. But this is one study that has already been published. It was done in 43 primarily ex-athletes with a history of concussions or repetitive head accelerations. Again, they underwent 8 weeks of treatment with the neurogamma, 20-minute session treatments every other day. And then they looked at changes in reaction time and motor function. So in this group, what was seen is that following treatment with the neurogamma, they had improved reaction time, so reduced reaction time, improved motor dexterity, hand-eye coordination, grip strength, and balance. So this is important for the application both in TBI rehabilitation, but also is very relevant to sports performance as well. So after seeing all this promising work from Utah University, we have decided to pursue medical device licensing as a treatment for TBI. And this is a space where there's a huge need for an effective treatment. So we are working currently on a pilot and pivotal study designs to pursue licensing for this indication. I'll just quickly go over our affiliate and distributor programs. So for clinicians and practitioners, we do have both affiliate and distributor programs available. So if someone were to become an affiliate, a Vielight affiliate, they would be given a personalized coupon code. And when that coupon code is used, the patient purchasing the device receives a 10% discount off the device. And then the affiliate also receives 10% of the purchase price back to them. We also have the Vielight distributor program for our clinicians and practitioners. With this program, clinicians and practitioners can purchase the devices at discounted rates, and the discount you receive depends on the number of devices being purchased, and then the clinician is able to sell the devices to patients as a distributor. And this is the discount code. Just want to put it here for you. Not shared it at the beginning of the presentation, but this is this BR2025 can be used for a 10% discount off our devices. All right, thank you. And I guess I'll pass it back to Naz.
Perfect, Jenna. Thank you so much. Please send your questions. If you have any questions for Jenna, please send them on the chat and we will address them sometime very soon. I guess we can go on to Penny Jean's talk. This is going to be very exciting for all of us.
Can you guys see my screen?
Yes, we do.
Excellent. The first thing I will start out with is asking for your indulgence in the fact that it really helps me to have my slides in the preview pane format so that I can see what's coming. It'll help me stay better organized and make best use of my time. So thank you for allowing me that visual distraction. Okay, so I am actually super excited about our topic today because it is very I think, personal to most of us. And the majority of what I guess I would call my career has made it almost impossible that I was not going to arrive at photobiomodulation as a very central element to sort of the neuromodulation universe in which I've been operating, trying to learn about, and trying to help contribute new innovative developments too. So my background is primarily mental health. And my master's is actually in mental health and rehabilitation. So even from an early point in considering how to help people function better, combining the idea of disability or injury or illness as the central component to what impacts our mental health has always been front and center for me. So I am also a licensed mental health clinician, and I have worked with the American Mental Health Counseling Association for some years, and I've done multiple talks about interpersonal and relationship violence and how a lot of times we misdiagnose brain injury as other things, as psychiatric illnesses. And so when we talk about like what happens to the brain and how does that impact mental health and function, I've spent a lot of time asking those questions and having conversations with many other experts in various disciplines. The other thing that I will mention before I get going is that fairly early on, because of my just general interest in neuromodulation, I also got pretty involved in neurotechnology, especially EEG-based neurotechnology. And so I'm currently board certified in neurofeedback and also in the quantitative analysis of EEG, looking at brain waves, brain signaling, and then trying to understand what it tells us, both for potentially modulating, using tech to modulate brain activity, but also for just being able to look at data, pre-post data, as I introduce different techniques into the treatment arc of an individual. Okay, so the reason I bring this up is because when I talk about the mental health components, essentially of brain function, I think that often we consider mental health to be separate, like mind to be separate from brain. And so when you go into to a therapist, you talk about your feelings. And one of the things that became very clear to me, I would say super early, even in my internship practicum days in mental health, was how important brain injury and potentially illness was, like how much it impacted our psychiatric experience and also just how much it impacted cognitive and emotional regulation and response. And so when we even consider like brain injury, there is a tremendous amount of conversation around what is happening to the brain that causes the injuries. And according to the CDC, our primary leading causes of injury are going to be falls, which I think honestly can happen at any age, but often directly impacts people in their later years when balance starts to become an issue. The other thing that I think I didn't realize until like sometime recently doing some research into it was how high up in the list that firearm related suicide was in the list of what we would consider to be causes of traumatic brain injury. And for me, that is a very clear mental health issue as well. So part of what I'm talking about here is what can we potentially do on the front end preventatively with devices that we have before we even get to these severe outcomes. The other thing I think will be familiar with a number of people attending today is the idea of brain injury that potentially comes from car accidents, motor vehicle accidents. I say motor vehicle because also there are probably potentially motorcyclists who've fallen off their bike a time or two and bonked their heads. And then also, people get into fights. That's a thing. I think we've noticed that, especially recently. And so when we talk about injury, there's a number of ways it happens that I think we are all fairly familiar with. The other way that I think maybe we don't always consider injury are illness related or illness driven components of injury. So I think a lot of us do already know that inflammation, sort of chronic or pathological levels of inflammation, can create tissue injury. But I think sometimes we don't realize that actual physical impact can also trigger things that we consider to just maybe come from viral infection or illness. So, for example, repeated concussive impact can re-trigger latent viral latent viral infection that can then turn into actual neurodegenerative disease. So there's also another thing that I want to briefly mention, which is that when we consider the ways that many of the viral infections that we experience potentially have a respiratory origin, we breathe it in potentially. And we think about almost that direct connection between those nasal passages, the sinus cavity, the olfactory bulb, and those direct neuronal connections between those nasal cavity signaling inputs and our brain. That's going to be very relevant to what I think is one of the primary components I really appreciate about the Vielight devices, which is that a good selection of them have an intranasal component. So there is an entryway potentially for illness injury, and then there is also a therapeutic application specifically that is intranasal. Okay, so if we are considering practically how we would take Vielight devices and potentially integrate them in to whatever our current clinical practice is, the big questions are, do I have to do it specifically in the office and supervise everyone all the time? Or is this something that people can potentially purchase, take home and use in between coming to see me for sessions, or possibly even as like just a general standalone device that I can supervise with them remotely? Part of what we would consider when we're thinking about those decisions are what the options are even with the product line availability. So there are a much wider variety of products than what I'm showing you on this summary slide, but this is a sort of a super easy entry gateway option, a really nice middle of the road so far as economy as well as efficacy option, and then our super fancy NeuroPro line that Naz will also be giving us a little bit more information about when I wrap up. So, okay, the let me actually slide down here. Boop, boop, boop. The multimodal intranasal photobiomodulation, the little handheld device that is one of the most economical, kind of easy entryway into using photobiomodulation. This is the one that potentially has a couple of intranasal applicators that go up your nose. And for a lot of people, I think putting something up your nose is a little bit odd and weird. But when you've explained to them that when you think about like what your skull bones look like and where there are actually cavities potentially in that skull, so there is more possible penetration effect of light through places where there are not skull bone, when we discuss transcranial photobiomodulation, which is primarily doing photobiomodulation on the head, we really do have to have discussions about penetration through bone. A lot of the red light therapy research that we've seen over the years have been, even some of the cold laser therapy has been, application to tissue that is not through bone, right? We used it a lot for skin, like for wound healing or cosmetic reasons. And so when we actually change the conversation to transcranial photobiomodulation, trying to think about it, wavelength penetration through bone, then it's almost a little bit of a cheat code to be able to put something up your nose, where there's just less bone between your brain potentially and that light. So I think when you explain that to people, just like here's the reason why this is potentially very efficacious and also economical, it's a much easier sell, just emotionally. And so I consider this little MIP device to be a really strong workhorse for a couple of reasons. One being, I've spent a couple years putting it up people's noses and doing some pre-post EEG analytics of what brain changes I can observe in addition to potential symptomatic impacts. And there is, just like Jenna was saying earlier, fairly significant impacts to immediate and even like over long-term brain state simply from the intranasal photobiomodulation itself. So this as a possible entry-level device, especially for people to maybe take home and use, I think is a really good consideration. Okay, the NeuroDuo line, Gina had mentioned there was one that stems 10 hertz, one that stems 40 hertz, and one that it does both. So when we talk about, oh, you can pulse it at 10 hertz or oh, you can pulse it at 40 hertz, I think one of the important things to kind of understand about the NeuroDuo line is that, and about the MIP and about the NeuroPro, is these particular three are all using LEDs that have an 810 nanometer wavelength. Okay, so they have, and I'm gonna skip around just a little bit and come back. Forgive me. Why 810 nanometers? So we have LEDs that are at different wavelengths. The reason I'm sort of showcasing the 810 nanometer LED is because we've got some pretty solid research that there is pretty reliable penetration with that wavelength in particular. And part of the reason it's so interesting is because when you consider the things that potentially can uptake or can absorb the photons that we are trying to offer the brain in support of its recovery, pretty much almost all the wavelengths. So we talk about wavelength, right? Wavelength meaning just like how long or how short the wavelength of light is. So when we talk about wavelength, the shorter wavelengths are more easily absorbed by the blood, and the longer wavelengths are more easily absorbed by the water volume potentially in the tissue as well. So there's this fun little window right above 800 where there seems to be kind of optimal absorption of photons for therapeutic purposes. So 810 seems to be like a good choice just as a starting point for a lot of things. So we've got the possible sort of like solid efficacy of that 810 nanometer red light penetration. That is its own independent therapeutic like effect. However, the idea of being able to also pulse. So we've got that 810 light, right? That's the wavelength. That's just what the LED does. We can actually turn it off and on at a set number of times per second. So we can pulse it at 10 hertz, turn it off and on 10 times a second. We can pulse it at 40, turn it off and on 40 times a second. So we have then the potential pulse frequency as an additional therapeutic element on top of even just what we're expecting from the 810 nanometer wavelength itself. So when you were thinking about the intranasals, there is an option to kind of either purchase the whole thing all together, like you can purchase like a whole combined set, or you can kind of build your own, whatever you want there. You can purchase the little handheld set independently and then pick whichever intranasal LEDs that you want. And for some people, a starter economic option with some possible impact could be purchasing the handheld device and then two of the 810 nanometer LEDs that you can apply simultaneously and then pulse both of them at 10 hertz or pulse both of them at 40 for a bit of a double barrel effect. Now, my personal opinion is you're going to get the greatest value for your investment if you actually purchase a whole set and then add an extra 810 on top of it. But people have different reasons for being interested in the different wavelengths of light. And so, bare minimum, if you're looking for some strong therapeutic impact for somebody, especially as a potential home use device, getting two of those 810s because you can plug them in and then you can toggle between both of them pulsing at 10 hertz or both of them pulsing at 40. And I have firsthand seen the potential impact of that double barrel effect on some people, both just symptomatically, observationally, and also watching what their brain's doing in real time. Because let me tell you, it's pretty easy to hook somebody up to EEG sensors when you've only got intranasals in the nose. So I feel pretty solid about this as a good starter option for a lot of people. Now, the reason I went off on the little 810 wavelength versus the pulsing option is because with the Neuro Duo, you also have the capacity to toggle between pulsing all the LEDs at 10 hertz or pulsing them all at 40 hertz. So it also has the 810 LED. And then the other thing that is really kind of critical here is just thinking about the placement of the LEDs themselves, which I'm going to talk a little bit more about in just 1 minute. But the idea of potentially having an intranasal, so you'll notice there is a single intranasal applicator, which you can actually move. You can put on either side. So sometimes if we consider how we might even want to deploy this one is also a potential send home with somebody. It's pretty easy. You stick it on and put the intranasal up your nose. There are a couple of considerations for this one as well, which is you can have your people potentially shift the intranasal halfway through the session to the other side of the nose to kind of get double coverage. Or if you know you've got some locational potential injury or impact, you can choose purposefully to keep it on in one nostril to maybe enhance a little bit of a lateral effect. Now, you guys will notice that there's also, like, if we look at the placement, remember Jenna had earlier said about the default mode network, the decisions between kind of like where these LEDs were placed was with that consideration in mind that if you, wherever it is that you locationally position an LED, we are essentially tapping into sort of that network hub design and accessing the idea of like what can we stimulate potentially simultaneously in synchrony or even asynchronously, what can we potentially stimulate? And you'll notice that there is an LED back at the sort of almost like at the base of the skull in that sort of back of the brain, cerebellum, almost brainstem region. So when we consider too these placements, we've got an intranasal, almost like bottom of the front of the brain, one back at the bottom of the back of the brain, and then we've got some very nice frontal to parietal as well as the sensory motor strip placements. This is really good hub coverage. So this is why, you know, the Neuro Duo tends to be an excellent starter for people who are looking for just a little bit more transcranial coverage than just that intranasal, but aren't quite ready to jump all the way into the Neuro Pro line. The Neuro Pro 2 is that most recent customizable option that Nas is going to give you a little bit more information about. And this one actually has 10 transcranial LEDs and 2 intranasal. This is a lot of power. And so the reason that this one is appealing for a number of people and unappealing for other people is the exact same reason, which is its extensive programmability and customizability. So when you are considering, okay, what is going to be economical and easy to deploy, the intranasal MIP or the Neuro Duo line, those are going to be your easiest, most economical ones to just get on people and run. Really, the only decisions is do you want 10 hertz or 40, or maybe one of the other wavelengths with the MIP. Like that's pretty much it. I am going to discuss placement around other therapies, and I am also going to discuss like maybe length of session or frequency of session. But for the purposes of just what do we have on the table to choose from, I'm going to skip just a smidge. When we consider those LEDs that are available in that more sort of customized Neuro Pro line, what really is the appeal for some people is you can pick any of these LEDs and then you can basically pick whatever frequency you want them to pulse at. And then you can pick how many at what time. Like you can kind of build almost anything you can imagine here. Now, for some people, this sounds very fun and exciting. And for other people, it sounds horribly overwhelming because they're like, what would I even choose? Part of what makes this fun is if you are someone who has some background in neuroanatomy or neurophysiology, and you understand some of the locational potential of like which LEDs are hanging out where on the in the brain or where on the scalp, what's happening directly underneath which LEDs, you can potentially build some customized network combinations of LEDs to affect different functions. So this is one of the appeals. When I say things like, okay, why would we do 40 hertz versus 10 hertz? Or how would we pick different frequencies potentially for using with this ultimately customizable line? The direction that I'm coming from EEG land, it holds this concept that there are faster and slower brain waves and that they do different jobs. So part of what allows people to select out or customize things is understanding, oh, faster brain waves are kind of in charge of more attentional, externally oriented complex processing. Slower brain waves do more like physical support, repair, consolidation. So when we're thinking through like why would we pick things, we've got this like maybe more possible complex array of options, but remember how we've simplified that down. Okay, 10 hertz, 40 hertz. So if you're just thinking intranasal or just thinking maybe that neuro duo as possibly either having in office or even sending home with people, couple of considerations. So let's say I've got some devices, big fancy ones or slightly less fancy, more economical ones that still carry a punch. How would I actually consider potentially using them as possible send home standalone devices to some degree, or potentially in the office? So there's a couple things that we would consider. One is that if we think about the possible energetic priming elements of what we're discussing, and what is this, slide 8? Bookmark, so I can come right back. When we're even discussing like what are those how are we helping the brain do stuff? Jen did a really great job of talking about some of that, and I will actually turn this slide deck into a PDF and make this available for people who are interested. I'm happy to just make this available to the Vielight team so we can just send it out. You guys just let them know if you want it and we can get it to you. Um, I just grabbed a couple of, I mean, there's like so much research currently out there. I just grabbed a few to briefly highlight. For example, brain-derived neurotrophic factor is one of the things that people talk about quite a bit when we discuss cellular repair, injury, aging, neurodegenerative disease. So, for example, um, BDNF regulates glucose and energy metabolism. And so when we think about the neuronal survival and growth, and even plasticity is a fancy word. How is the brain actually engaging? How is it remembering anything? Like the whole process of learning and recovery is your capacity to either relearn something you already knew or learn a new thing to adapt or compensate for potential injury that may be permanent, but how can we work around it to recover as much function as possible, right? And so when we're even just thinking through, like, for example, uh, I believe Jenna used the term neurogenesis. Okay, synaptic neurogenesis was a phrase that really caught my attention a few years ago when I was trying to think through how would we potentially use photobiomodulation in conjunction potentially with some of the EEG stuff I was very interested in as well, right? And so this idea of synaptic neurogenesis, essentially genesis, the formulation of or the creation of new synapses, how are we actually supporting the brain's capacity to repair itself? And so the idea of like what photobiomodulation potentially can do at that cellular level, that was just really appealing for me. Especially, I don't know about you guys, but I'm in my mid 40s and I'm starting to really think about that second half of my life and like what aging well looks like and potentially supporting other people who are, sort of paving paving that road for me. And so just considering the combination of cumulative injury and illness that we all experience over our lifespan and what we can do to put that's both reparative and preventative, photobiomodulation just really shone, I guess all puns intended, really kind of stood out for me as something I'd want to layer in with other therapies. Okay, so back to other therapies. If I was considering how to use it, like how would I integrate it in with other things? One of the ways that you could think about it is having people purchase devices and simply take them home and use them regularly throughout the week before they, or, throughout the month before they potentially come back in to see you for you delivering whatever your in-office kind of specialization is. Yeah. So if you are potentially someone who does neurofeedback or someone who does chiropractic or physical therapy, like if you're thinking like, what am I kind of physically doing to support, brain repair, brain recovery, brain learning? One of the things that, so the reason I went and looked at all the BDNF stuff is this idea of being able to kind of energize or create sort of a cellular level response that then really supports repair, formation of new synapses, and potentially even learning and retention, right? So this idea of, okay, we can have people do this at home. If we would like for them to potentially come in, let's say maybe we've got the NeuroPro line, like the fancy one with all the customizability, how would we deploy it? So there's a couple things to think about. One is that, okay, let's say that we do energize the brain with this. That's probably potentially a fairly significant energy expenditure to have that process and response. So for some people that come into your clinic or practice who already have a history of, let's say maybe low energy and low resiliency, right? People who fatigue easily. There's a different number of ways you can fatigue easily, but let's focus on maybe just like sort of that physical and or cognitive fatigue experience that people have when they already maybe have a history of chronic fatigue problems, or they're fairly early in their injury recovery arc. And so they just don't have a lot of that resiliency yet. So when we are considering there's genuinely clear therapeutic impacts to using photobiomodulation, but it takes energy for the brain and body to repair itself. So one of the things you can consider is potentially doing a handful of sessions simply priming over some stretch of time with photobiomodulation before you start integrating in other therapies. That is a priming option. If you've got somebody that has a little bit more, energy and resiliency, you could start off a session with photobiomodulation for that maybe energization effect, and then do other things behind it. I've had a handful of people tell me that they like to do other therapies and then potentially some photobiomodulation at the end of a session, maybe for the integration, possible anti-inflammatory, and then possible relaxation elements that they experience, which leads us to 10 hertz or 40. How do we decide? How are they different? So remember the slower brain states and the faster brain states. So let's say 10 hertz is right in the middle of slower brain waves and faster brain waves, right? 40 hertz is going to be a faster brain wave. 10 hertz is what we consider on the slower end, but I'd say it's a little bit more in the middle. So when we think about the reasons people have trouble potentially with functioning, the idea of having sort of state flexibility, can I speed up into brain waves that help me engage and focus and do productive things? Can I slow down into brain waves that really focus on repair and physical support and regeneration and, consolidation, integration? A healthy, flexible brain will go back and forth appropriately between more engaged, more relaxed, more engaged, more relaxed, based on environmental demands and cues. However, a lot of us who have potentially cumulative histories of injury and or illness, the brain will get stuck a little bit in slow, trying to repair injury, right, or illness, or it potentially can get stuck in the faster waves, being more. Uh, and I don't think it's unfair to associate being stuck in faster frequency response sets as being correlatable or mappable to people who have like hyperexcitability, like cortical hyperexcitability. Maybe there's sort of a chronic inflammatory response. Potentially, they have learned responses over time from a history of trauma, right? There's a lot of people that come back as veterans, from deployment, and they've got kind of ongoing hypervigilance and trauma responses. So there's a lot of on-attentive behavior that doesn't necessarily allow them to relax into states that favor sleep and rest and repair. So when we think about people getting stuck in faster externally oriented brain states where they can't slow down, rest, and repair, or people getting stuck in slower brain states where they can't speed up and appropriately engage, this is part of where that 10 hertz, 40 hertz option comes from, right? You might introduce a 10 hertz option for people who are maybe stuck in fast, and we would really like for their brain to, we're trying to model with that 10 hertz frequency, we're trying to model that relaxation, that slow down, that shift into a more slower state. And then with the 40 hertz, we're potentially trying to model engagement, speeding up, maybe more that productive state. Here's the thing about injury and illness. It's not the same for everybody. The combination of things that have impacted us are not the same for everyone, right? And so what ends up potentially happening is that some people will have very immediate, noticeable responses to the 40 hertz, they'll feel dialed in and energized and feel like they really can kind of manage complex tasking better. Whereas other people, you introduce 40 hertz and they feel overstimulated. It's a little too much for them. They don't feel like that's helpful at all. For some people, 10 hertz is very relaxing. You will literally see them go boneless after about maybe 10, 15 minutes of hanging out in a 10 hertz device deployment, right? You can physically observe the relaxation effects. Even if they don't have like that strong physiological response, you can observe people shift into sort of a more relaxed, almost open state. You can see them shift down out of that faster, kind of almost like rigid, perseverant, almost anxious hypervigilance. You can see them relax, right? Um, for some people, that 10 hertz is really delightful. They actually feel energized from the 10 hertz because they're able to kind of corral all that energy they were burning off being stressed and anxious and hypervigilant. They're able to actually kind of shift that into being more present and focused and connected and aware. So for some people, 10 hertz is really the banger, right? Other people, 10 hertz, they don't have much of an effect. They don't notice much because they're already hanging out. Like they're pretty good on the slow end of the spectrum. They need more of the 40 hertz for the recruitment and the engagement. This is not something that you can easily figure out on the front end. Most of the time, you're going to need a decent handful of screening questions, trying to ask them about what is their experience, what are they coming for, what are the sort of the states they find themselves hanging out in the most of the time. So you can, like, you don't need fancy EEG brain maps to be able to ask some good questions around what do you have going on, and then making your best guess, your best educated guess about where to start based on kind of what we know 10 or 40 hertz does. So that as like a framework, I think is really helpful just for us considering how we might, kick people off. Now, I say that. The other thing that I think that we should consider as well is the idea of dosing. Like, how do we decide how long a session should be, how frequently they should do it, right? Are we going to do 40 hertz in the morning, like a little caffeine, and 10 hertz at night, like a little melatonin? Like, how would we actually make these decisions? And so the first couple weeks, I'd say maybe the first 5 to 10 sessions of you doing photobiomodulation with a person is really your second more critical intake. You are trying some things with them, and then you are seeing what their brain likes, what recruits their brain, what they respond to, and you are also gauging for fatigue indicators. One of the big key things I highly recommend everybody do is ask a handful of questions from everyone at the beginning. Talk to me about what happens when you are overly tired, when you don't sleep, when you don't eat, when you're dehydrated, when you're like have kind of chronic discomfort, right? Because if you have various like physically uncomfortable things, like you're in pain or you've got a bladder condition or if there are, you have trouble regulating your temperature, so you're just miserably hot or miserably cold all the time. If you actually have things that are going on that genuinely sap your energy, then we all know what we are like when we are overly tired. So some people are very snappy, irritable, and angry. They react. Some people are more emotional, they cry. Some people really shut down and withdraw. Some people kind of hyper engage in almost like a pathological way. So we ask people like, what are you like when you've really gone past your fatigue thresholds? Because what we're going to do is we're going to start looking for that in the first handful of sessions to see are they a little too tired or a little too wired, and then we're going to use that to gauge pacing. And so when we are thinking through like what are the options with pacing, if you're doing just intranasal, you can do shorter sessions. You can do sessions farther apart. When you are thinking neuroduo, this is not a Vielight recommended option, but this is a penny gene experimentation, which has seemed to work out fairly well for a number of the people I've tried it on. You can take light blocking fabric and you can wrap a couple of LEDs on the devices to reduce how many LEDs are actually active in any given time. So if you've got a neuroduo of any type, a neuroduo, hang on, is it like is neuroduo the name of the one that also just does alpha and also just does gamma? Do we also, okay, sorry, my apologies. I was thinking duo as in like the one that does both the 10 and 40 hertz, but I think we're just calling it all duo. So if you have a neuroduo and you've got those 5 transcranial LEDs in the intranasal, you can potentially do nothing but plug in the one intranasal on somebody. That is a ramp down option, 100%. You can just use intranasal from the neuroduo. But you can potentially do something like wrap all the LEDs except for the one in the back, wrap a couple of the LEDs like from anywhere you want. So you can reduce how many LEDs are even like as active or as penetrable, right? By just reducing, you can just turn it on, let it run, and then cherry pick which ones you actually want to have easier access to the skull, to the scalp. So that is a possible way to maybe mitigate. So however many LEDs that you've got going at the same time, how long the session is and how frequent the sessions are, those are ways for you to essentially dose out. Because one of the things that has absolutely emerged from transcranial photobiomodulation and just red light therapy research in general is that biphasic effect. Like at some point, you give somebody too much and it stops being therapeutic and you're not really potentially seeing the effects that you would want from it, right? So you having just a framework for how would I maybe mitigate and or dose, it's, as you can see, not like that hard to dial that up or down. With the NeuroPro line, you don't have to wrap anything physically because you can simply select out of which ones that are active. You get to decide. You get to decide out of the available ones, you get to decide which ones are on or off. So you can pick just a couple of them and turn them on, and then you get to decide which of the frequencies you would like them to pulse at. So you can make some slightly more customizable decisions with that NeuroPro too. I'm gonna show you one more thing, and then I'm going to stop and either take questions or potentially, if there aren't any, transition over to Naz giving you some more deets about the NeuroPro too. The idea of like, why would we select intranasal, handful of transcranial, a lot more of the transcranial with the double intranasal and customizability? Like, why would we be making these choices? A big part of what we're really trying to think through are what parts of the brain are supposed to be responsible for what types of functions. And then like, so there's sort of this localization element, like what do we actually have an LED on top of to recruit, like what's immediately under it, but also the idea of a possible network effect. You put LEDs at strategic places, you turn them all on at the same time, we essentially compose somewhat of a network, an associative network effect, right? So the idea of potentially even just having the intranasal and an LED back at the base of the, sort of the back of the head, right at the base of the skull, maybe where that cerebellar region is. Part of the struggle of doing non-invasive therapy, like not taking out that Craftsman drilling holes, and then putting electrodes or LEDs directly into brain tissue, part of the struggle of not doing invasive intervention is the reality that we are not going to have like those deep brain level access elements that you do within an invasive therapy, right? With like surgery or implantation, right? Of a modulatory device. And so because of that, we're trying to think through the actual circuitry, what's happening at the bottom of the brain that we might have a little bit less direct access to, what's happening more across the upper cortical regions, because there are subcortical to cortical circuits. And so how do so if you change the information at the top of a circuit, it'll change the information processing through the whole circuit. So one of the ways that we have over the years really tried to impact lower brain function has been to potentially interact with higher pyramidal neurons or cortical function and then say, okay, we know you've got circuits down to the bottom of the brain. We're going to try to change what's happening up here. And we know that change requires the whole circuit to interact, right? So we kind of do that indirect approach. But one of the things about having an intranasal and a possible LED stem placement at the back of the head is we are doing the best we can to grab whatever that lower brain circuitry stimulation options are. So even just doing something in the nose and that LED at the base of the skull, I have seen significant full brain impacts, even just from trying to hit whatever we can lower in the brain. And so us trying to think through like, why would we care about bottom of the brain to top of the brain? Your selections, which LEDs you want on, how customizable or fancy you want your unit to be. I do think at the beginning it's kind of a lot to think through, but the science behind why and how we would choose things, even though we are integrating multiple disciplines to essentially create new science and new innovations in those interdependent applications, we have 100 years of very solid neuroscience and neuroimaging, fairly reliable structural information about the brain. And we've got a pretty decent long term, robust set of data about how light interacts with tissue, both peripheral and central. So we are putting together things that from different areas that make a lot of sense independently. Then we're trying to kind of stack and enhance possible efficacy by combining these things. Okay, I am gonna stop. Do you guys have any questions prior to Nas giving you a little bit more information about that NeuroPro 2?
Yes, Penny, we do have a couple of questions posted on the Q&A section. So maybe I can just quickly go over the NeuroPro device,
Sure.
and then give Austin a few more minutes to just talk about the affiliate program, and then we can go into the Q&A session if that's a good practice. Okay, perfect. Thank you so much, Penny Jean. That was very educational, very, very much lovely to hear about the insights. I always learn a lot from your perspective. So to give you a quick overview, and let me just share my screen in full screen. Just 1 second. This is the technical thing you have with Zoom. Okay, perfect. Okay, perfect. So you mentioned about the NeuroPro 2 device. This is the device that Austin and I are managing, and we are very much excited about it because it gives you a lot of flexibility. So you can play around with it. You can just explore on your own pace, depending on what are the applications that you want to use device. So the look of it, aesthetically, it is better. It is more comfortable. Better contact, obviously, on the LEDs with the scalp. More LEDs. So the number of LEDs on this device had been doubled. So we have 10 LEDs over the head and 2 LEDs for intranasal applications. And so why we added those locations and why we have those 10 LEDs over the head is not only that we are covering the default mode network, but we would be covering the salience network and central executive network. So other areas of the brain that would be affected are covered in this application. So what is customizable? What is new with this device is that it comes with an app and a phone. So you actually connect to the phone, and you can pretty much program the device the way you want it. So you can change the frequency, the pulsation, the flickering frequency of the light from 1 hertz all the way to 9,999 hertz. You can have in phase or out of phase modulation between LEDs. You can sweep the power up. So if someone can't tolerate at 100% of the power, they can just start off at maybe 50% and then increase the power up. You can do cross-frequency coupling at one location. So taking one location of the LED and having two pulsating frequencies on that. And we do have several programmed embedded applications in this device. So the alpha gamma protocol that comes from our research is already embedded there. So it is a combination between the alpha pulsation and the gamma pulsation. We have one embedded program from Dr. Sanjay Manchanda on the meditation. So that allows anyone who is a meditator or who would like to experience meditating to lock into that space of, I guess, nowhereness, nothingness, to that elevated space of meditation. And then excitingly for me is that we have 5 protocols from Penny Jean on this device regarding different applications and a lot of different aspects that if you're interested to learn more about that, because I know that we have covered all those in previous webinars, I don't want to go into details on that. I just want to get into the mains of the questions that you guys have. And if you have any further questions regarding any of those programs, just email us separately on those. But those are the exciting add-ons that we have with this device. So there is on each LED, there is sufficient penetration power. And I can actually give you 2 use cases or 2 of the applications or examples that the device can be used. For instance, it could be actually something of benefit, of further benefit to the other devices that we had in the past. So for instance, Jenna was mentioning about a study that we had regarding the stroke. And so what we found in that study is that if the LEDs if the LEDs on the side of the stroke are on, and then the rest of the LEDs on the opposite side are turned off, then there's that application of the device would actually give the most benefit, or that would be the best efficient way of using the device. So with the NeuroPro 2, you have the ability to turn some of the LEDs on and then leave some others off. So those are the applications that you can use. The other use case that maybe I can actually give you right now is I mentioned about the cross-frequency coupling feature. That means on one location, you can have 2 frequencies. For instance, you want to add 4 hertz and 40 hertz. So doing like, let's say, theta gamma coupling. So research has shown that theta gamma coupling has something to do with memory consolidation. So maybe having those 2 frequencies at one location can actually enhance your application for in clinic or for your own personal use of the device. So those are just 2 quick examples of how you can actually benefit from using it. And so this is a good opportunity for any of the practitioners out there to use the device to enhance the solution for their own clients. I know that Penny Jean had spoken about that. This is a good opportunity for researchers. If you have ideas, if you want to pick up some devices, any design of a new study, please get in touch with us. And this is an excellent opportunity and era for the field of photobiomodulation. So I just want to wrap up. Just quickly wanted to overview the features on the NeuroPro device. And if you have any questions, please contact us at the NeuroPro line or at the main line of the general wellness devices. So I'll stop here and I'll pass it on to Austin, I guess, to talk about the affiliate.
Yep. Great. All right. Thanks so much, Naz. So I'll share my screen as well. Okay, everybody can see this? Okay, perfect. So yeah, I guess Jenna already touched on it and Naz just touched on it, but I'll summarize it all together. There's many different ways that you can work with Vielight. So we have different programs. We have research programs, we have an introducer program, and we have a reseller program. So all of our information is on our website, but I'll just try to explain it in a way it's very easy to understand. And so the first program we have is the research program. So here at Vielight, we have a team of 7 PhD scientists, and these PhD scientists, including people like Naz and Jenna, we've interacted and assisted many different organizations in designing and helping them to structure these different studies. So if there is any researchers on the call and you are interested in the research program and doing research with us, we have devices like the NeuroPro 2, which is fully customizable and a great device for research. So you can definitely get in touch with us, and I'll be linking all the information of who to contact for these specific programs at the end. And so the next program I'll introduce is the Introducer program. And so this is your traditional affiliate program. The way that it works is if you purchase one Vielight device, you can then create a coupon code. And this coupon code is something that people can use if they want to purchase devices and they hear about it through you. So for example, if you purchase one of our Duo devices and you have a friend that would like to buy a Duo device, the way it would work is you would provide them your discount code to use. They would get 10% off the purchase of their device, and then you'll earn a 10% commission as well. And so it's a really easy to use way of earning some passive income, especially if you're a user of our devices already and you tell some friends and they want to purchase. So the other program that we have is the reseller program. And so this is designed more for health and wellness clinicians. This is for somebody that has some influence or somebody that is trying to be a bit more involved with us. And so the way that this program works is that we'll be giving you access to devices, and it's a tiered pricing structure depending on how many devices you purchase. So the requirements for this is that you're a practitioner in a health or a wellness space, that you have a degree from a recognized institution, you have a relevant business or health practice with a physical location, business license, or if you're a social influencer in the space of health and wellness. And so we kind of take this on a case-by-case basis, and this is definitely something a bit more involved than the Introducer program, but both of these programs do exist. And so if you do want to connect and you're interested in any of these programs, our research program, you can email us at research@vielight.com. The reseller program, there's a form that's on this website. And the Introducer program, there's a form that's on this website. So if you're to just go to the vielight.com website, you'll see an opportunity to work with us, and you can just click on that link. And if you do need any more assistance on this, feel free to just give us a phone call or an email, and we'll be able to guide you to the right place. And yeah, so there's not too much more than that. If you have any specific questions about the way it's structured or set up, we'll be happy to help with that too.
That's amazing.
And I'll head it back to Naz.
Yes, sure. So we can go to the Q&A session right now, and I can see that there has been some questions posted. So maybe I can just, yes, please keep posting your questions on the chat. We will get to them. So I have a couple of questions for Jenna. A person is asking, do you need to continue use of photobiomodulation for the positive effect to be maintained?
Yeah, so that's a great question. Just checking you can hear me still?
Yes.
Perfect, okay. So what we've seen is, from our research so far, we've seen that it does seem that you need to continue treatment to maintain the effect, at least for certain conditions that we've explored. So for example, in patients with dementia, we've seen that you need continued treatment. So we saw that once treatment was stopped in that population, there was some decline after the treatment. Now, one important consideration here is that is a progressive degenerative disorder where they're going to continue declining. And so it makes sense that when you stop the treatment, there may be some decline in performance. This may not be the same for other conditions, such as maybe like an acute traumatic brain injury. Whereas if you have athletes with who are constantly exposed to concussions or repetitive head acceleration events, again, you might want to continue treatment. So we're still learning more, but right now, at least for if you know that there's some continued damage or negative impacts to the brain or some sort of progressive disorder, it's likely that you should continue treatment to maintain the benefits.
Thank you, Jenna. The other question for you is that can we use photobiomodulation alongside audio neurostimulation, such as Tomatis method?
Yeah, that's a great question. So we haven't explored yet the combination of our photobiomodulation with other forms of brain stimulation, such as maybe audio stimulation. One important thing to consider is that our mechanism is different. With photobiomodulation, you're acting on cellular energy, you're acting on cellular healing. So it is a different mechanism of action, but different forms of stimulation can impact brain oscillation. So there is work to be done in seeing how those could be synergistic or if they could cancel each other out. There's more to learn there. So currently a recommendation is if you have another modality you want to use it at a different time. With photobiomodulation, we do see that the dose response is biphasic, so you have like an optimal dose. And then when you go more than that, there might not be added benefit. And we make our recommendations on frequency of use based on that. If there is another modality that could produce similar effects, and you may again be kind of tipping over into the area of increasing potential for side effects or losing additional benefit. So currently the short answer to that is try to use it at a different time and pay attention to how you're responding. Ultimately there is some need for personalization. Everyone responds differently to different doses of stimulation. So, follow yourself, see how you're doing, but it's right now stimulate at different times.
Perfect. I'll ask you one more question and I'll switch back to Penny Jean for just the change of the type of questions, and then I'll come back to you, Jenna, again. Jenna, another question for you. Is there a reason why ear canal has not been included as an avenue for our light therapy entry?
Yeah. So the ear canal is not as direct of a way to access the brain as the nasal cavity. So you do have like the eardrum, and like the bones in the ear that would, if you're trying to target the brain, would be less direct of a way of targeting the brain. In terms of, we haven't done trials on this, but we have heard anecdotally people using it in their ear for some sort of inner ear problems. We've heard positive feedback, but we need the studies to learn more. So yeah.
Excellent. Thank you so much. I'll switch gear a bit. I'll ask a few questions that was posted for Penny Jean. Penny Jean, can you give some examples of changes in symptomology that you have observed? I guess throughout the years, that's the question is coming from.
Sure. So you guys probably remember the very generic framework that I was accessing, this idea of kind of the state flexibility. So when I think about what are the ways that people have trouble functioning, I trend towards categorizing that in terms of state persistence or rigidity. And when I say state, I really just mean when we think like neurophysiologically, what is happening, especially from years of looking at EEG and thinking through like functional correlates. The way that I'm going to talk about symptoms is as follows. I think almost everything functionally that we're having trouble with can be framed as difficulties with state flexibility or potentially difficulties with processing speed. So there's potentially local regions in your brain that are having trouble shifting back and forth between those different tasking states. So when I say state, I don't mean like, oh, altered state, like you took a fun drug, which is also fun, but I mean essentially the idea of you being able to do different tasks, right? So when you are hanging out in the slower brain waves, you do specific things. When you're hanging out in the faster brain waves, you do specific things. And so when I say that, what I mean is if different areas of your brain are in charge of different stuff, if you potentially have a focalized injury, like you actually had a physical impact, or you potentially had like some generalized inflammatory illness related, infection related issues, or maybe you had a respiratory infection point and now you've got like trouble with taste and smell, which trouble with taste and smell is a neurological damage element condition. Like Like people who got sick and now they can't smell stuff, like that's brain damage, that's injury. And so when we think through like what are the sort of the symptom categories? For most people, it's difficulty with engaging appropriately, like essentially, or difficulty with inhibiting appropriately, right? So we either can't manage sort of social and emotional response, but most of the time we can't manage that sort of inhibitory response because of a couple of reasons. One is that so with safe flexibility, if I cannot engage into complex processing, if there's a lot of stimulation happening around me, a lot of inputs coming in, I'm out in a group, there's noise. Like who hasn't had a day when there are too many noises happening and you can feel your socks and you haven't had enough to drink and it's just you get really irritable very quickly, right? So when we're talking about this combination of what kind of resources do I have available, how do I recruit them in a more complex dual inhibition, which is inhibiting stuff that I can impulsively do or say, and then inhibiting inputs that are coming in that are going to take up a lot of my resources to process and interact with. It takes resources to literally process any of that. So, very brief sidebar, when you take a kid who has ADD or ADHD, he's kind of hyperactive. We give hyperactive children stimulants. We give them like baby cocaine. We give hyperactive children stimulants and then they calm down. Why? Because we've created a bit of a resourcing element where they now have resources available, stimulation. They have resources available, often faster frequency stimulation behaviors available to do that dual inhibition, right? So you give a hyperactive kid, a stimulant, he calms down. What he has is the capacity to inhibit now. He can inhibit the impulsive stuff coming out. And it could be, doesn't have to be a little boy, but we see it a lot with the kiddos. You've got a kid who can inhibit potentially the impulsive behaviors coming out, but you can also see a kid who can inhibit or differentiate from or ignore all the distracting stuff potentially coming in so that they can focus. We know this is a thing. Stimulant medications work on a lot of people, kids or adults, because this is what they do. They create that capability for that more complex dual inhibition, which then allows for you to reroute whatever resources you have available on more focused or productive behavior. This is something we all kind of take for granted, like, yeah, that's how it works. However, not everybody loves potentially the impacts of taking medication. And so we look for other ways to create sort of that safe flexibility, the network recruitment, the complex dual inhibition. We're like, how do we make this happen, right? So the things that really suck your energy, that really take a lot of energy expenditure, is what I would call the sort of the pathological state persistence, where there is a lack of appropriate response and flexibility to changes in environmental demands and cues. So if you are too regularly persistent in faster waves, faster brain waves, so you are anxious, hypervigilant, irritable, rigid, all the things that might make you a little focused in on something, but you really cannot be, if you're distracted, you're very easily overstimulated and frustrated and angry. Or, any amount of like social complexity makes you like shut down. So the idea of like if you are too stuck in fast or too stuck in slow where you can't engage, pay attention, be productive, initiate tasks, get stuff done, have a certain amount of like interest and presence in your life. When we're just thinking through this idea of like people not being able to appropriately adapt to changes in their environment, I should behave differently when I'm laying down in my bed at home in the dark than when I am out on a bus in public, right? Those are two different task demands, right? So when the question being, what kind of changes have I seen in symptoms? The underlying structural differences is the capacity to maybe have resources available to do some of that better inhibition. And as you guys can now imagine, since I gave you such a wide ranging intro to my answer, you can imagine that can affect almost anything. So when we're thinking about how do we pay attention, how do we remember stuff, like, even just memory, memory is a bunch of different things. It is, can I pay attention in the first place to what's happening? Can I can I take the information in at all? Can I then encode it? Can I retain it? And then can I go and access it or retrieve it later? Can I hold multiple things in my memory at the same time? Complex working memory, right? However many data bits you can hold simultaneously is how nuanced or complex of an idea that you can think about. So all of like which is a processing speed related element, right? Because processing speed isn't necessarily how many things you can do in a row quickly. Sometimes processing speed is how many things you can do simultaneously. So when we're thinking about just function, people will primarily show up saying things like, I'm having trouble initiating things. I'm having trouble completing things. I'm having trouble regulating. Like, I can't be productive, right? I can't do stuff that like helps me get paid or helps me run my life. And then they'll say things like, I can't remember stuff. And like, so it's gonna be productivity, it's gonna be memory. And the other big thing is typically emotional regulation, right? And almost all of that can be wrapped up in how easily we're overstimulated. And that's how much our processing capability, like that bandwidth that we have to just deal with stuff that's coming in and then inhibit and make good selections about what's coming out. Like a lot of that, there's strong frontal cortex elements to that executive behavior for that sort of that inhibitory selective and prioritization. But there's like, the auditory components of your brain that take in all that auditory information, sort through it, pick out what's important, pay attention to what. The visual component we're trying to integrate with the auditory component, like that's that occipital part of your brain. The sensory motor strip that arranges your body in space, arranges your facial expressions that might or might not be appropriate for the interaction. Like we need all of the components of the brain to have a certain amount of flexibility locally so we can network and recruit them together into the more complex tasking behaviors. So when we're like, okay, what are the symptoms? Almost everybody's symptoms are going to be some component of like flexibility, problems with flexibility and problems with maybe network capability and processing speed, right? So when we do something like photobiomodulation integrated or adjunctive with other therapies, I mean, I think we all are familiar with what we do. We know how it helps. The idea of being able to add in something that produces more potential energy availability at a cellular level, you can imagine how that would enhance anything else you're already doing. But as even just a standalone treatment, the idea of being able to better recruit and metabolize energetic resources to do any of those things that I was talking about, the practical anecdotal stuff that I've observed over the years has been a combination of people dealing better with what I would consider to be, let's call it overstimulation or complex sensory processing. So the idea of like there's a lot happening. How easy is it for us to have the capacity or the bandwidth to engage with and respond to multisensory and multi-intellectual demands? So there's how do I prioritize and focus? How do I pay attention, absorb, encode, and retrieve? How do I dual inhibit so I'm not irritable because of the sensory assault that's coming in that I can't ignore, or I'm not too impulsive, in an interaction because I can't inhibit what's coming out. And so these are things that I see improve, like just sort of at a foundational level. And that means that the individual outcome, the individual cascade or constellation of results people get are honestly like kind of a unique combination for everyone, because as we're trying to repair some of that underlying structural capability, we're going to see that play out differently. But the big movement usually comes from capacity to manage, right? Sort of that processing and stimulation impact, like the dual inhibition, and then increased capacity for maybe tolerating demands, engaging with demands on us, and increased capacity for being able to initiate and complete tasks. I am going to throw in a plug real quick before I end this really long answer. I'm going to throw a plug in real quick for the kind of the critical component of sleep. and how much of the immune dysregulation, potential pathological levels of inflammatory response, and even sort of like the hormonal changes people experience as they age or just go through their lifespan. There are a lot of things that tend to impact and disrupt circadian rhythms and sleep. And so we know that there are strong light exposure components to circadian rhythms and the capacity even just to regulate your body to downshift your brain or downshift your sensory central nervous system into more relaxed states to even allow better sleep hygiene on the front end. Um, Even just focusing around how do we help a brain that's maybe revved out at max capacity and just goes until it crashes, which is not like a great cycle, but it's one many of us find ourselves in. Not a lot of good intentional regulation capability. These are the things that I'm seeing improve with use of photobiomodulation. Obviously, your mileage may vary depending on like what you're introducing it into and what the other contributing factors are. But these are the sort of the core clinical values I'm seeing emerge out of use.
Perfect, Penny Jean. Thank you. I have one question for Austin. Austin, are we attending the biohacking conference at the end of May?
We are not,
We're
no.
not this year.
Potentially some other ones, but not the one at the end of May, no.
Okay, okay, thank you. Penny Jean, back to you. Is there benefits to ocular biology, for instance, glaucoma vision loss?
Short answer is I don't know for sure. Medium answer is I am also deeply interested in this for a wide variety of reasons. Some personal, some just, general professional curiosity. I think that there is some very promising historical and emerging literature and science around the impacts of red light therapy specifically on eye tissue at a cellular level, so far as like anti-inflammatory capabilities and potentially some level of cellular repair and maybe a reduction of the oxidative stress components. And so I am seeing promising things emerge. But so far as here's what you should buy and here's how you should dose it, that I don't have an answer for yet. Give me another couple years.
Perfect, thank you.
I could quickly add to that. I know that PBM has been used successfully for macular degeneration. So yeah, there are applications, but we haven't done any research on the Vielight end for that yet.
Thank you so much. I have one question for Penny Jean. The question is about a stock in slow waves, light bulb that I guess you mentioned. So explain the ongoing recovery repair state due to injury or development imbalance.
I am not quite sure I understand that question.
I can ask the sender to maybe elaborate on the question.
That would be awesome. If they could do that, that would be great. You want me to take another one while they do that, or you want to
Sure,
toss it
yes,
back to
yes.
Jenna?
Okay, toggle back to Jenna, eh? All right. Jenna, I have one question. So if an Alzheimer's patient is currently on anti-monoclonal antibody treatment protocol, what is that nonconformity? What is the problem with that?
Anti-monoclonal antibody treatment, yeah, for Alzheimer's disease. Yeah. So again, we haven't explored that. I guess the question is using that with photobiomodulation. Is there a concern for that? Is that their question? Okay.
Exactly.
So yeah, so again, we haven't tried it in combination. One of the major potential side effects with anti-monoclonal antibody treatment for Alzheimer's disease is brain swelling or maybe brain bleeds. And that's where I could see like targeting light or photobiomodulation to the brain increases um, blood circulation to the brain, blood perfusion to the brain. So if there's an increased risk of brain bleeding due to the therapy, and then you're using PBM. So again, we haven't tested it. We don't have any safety data, but just there are significant side effects with the anti-monoclonal with that therapy to consider.
Perfect, thank you. I have another question in line with that for Alzheimer's patients as well who are being treated with Leqembi. Are there any contraindications for that treatment with light therapy? And also, if they had never had ARIA complications with that drug before, would you have any recommendations?
Great question. Again, we just don't have the answers at this moment to that. We can do some looking into it on our end, but yeah, we haven't tried the combination, so it would all be hypothetical at this point.
Sure, thank you. Penny Jean, to you, can the device improve tinnitus? Do you think?
That's a super interesting question because there's a lot of discussion around what actually causes tinnitus, right? One of the things that seems to be pretty clear is that sort of cortical column signaling potentially having some damage. So like potentially whiplash injury or some types of brain injury resulting in tinnitus. Because there's some damage to the auditory signaling column. So they're basically just continuously sending signals without like appropriate modulation, which is like a really ham-fisted, simplistic way of discussing tinnitus. But the idea of you potentially having it post brain injury is actually not uncommon. And some people honestly have stress-induced tinnitus that's somewhat stress state dependent. So if you actually have possible physical damage to the cortical column signaling because of like tissue damage, I'm not sure how this would potentially impact that. If you have more what I would consider to be stress dependent, stress induced tinnitus that comes and goes and is based a little bit more maybe on some of that oxidative stress or inflammatory stress response that we tend to have under various conditions, I think the Vielight would be more potentially helpful for what I consider to be like intermittent stress induced tinnitus, because that one is going to be more reliant on variables that I think the Vielight could potentially affect. So I think some of it would depend on the etiology, like the origin or type, frequency, severity of tinnitus. For the really entrenched severe stuff, I'm not sure. But I wouldn't write Vielight off entirely because we have what are we calling the Vegas device? Is it just the Vielight Vegas?
To be like
We've
Vegas.
got a Vegas device with a couple LEDs that you can kind of place, and theoretically they kind of go on the neck to simulate vagal nerve response. But you could just slide them up a little bit behind the ears. Like there's honestly like no real genuine limitations outside of like obviously we've got recommendations based on we actually tried this worked in this way, and therefore these are our official recommendations. But if you purchase a product, you can kind of put it wherever you want. I say this from personal experience, having taken a handful of like free LEDs and just putting them in all sorts of combinations in various places. There's really, I don't really think there's anything. I don't really think there's anything in the Vielight LED design that would be harmful other than maybe just you overdo it a little bit yourself and have some of those fatigue indicators, which you honestly should notice after one or two times of doing it a little too long. I wouldn't stick one right in my eye. Honestly, I don't think that's really a use I would recommend. But I mean, putting the pretty much anywhere else that's not your eyeball, I think is a worthy experiment.
Definitely, yes. Thank you. One other question for you, Penny Jean. If someone cannot tolerate intranasal, I guess, intrusion, would any extra nasal application still work?
Okay, if we're talking the intranasal applicator specifically, right? Because obviously we've got lots of extranasal options. But if we're talking the intranasal applicator specifically, like as a physical option, I have actually had a couple people who really just did not love stuff in their nose. There's usually two reasons people don't love it. One is they're not really managing the tension component, right? So there's a little clip and you sort of put the actual light up your nose, and then there's a clip that's supposed to hold it in there. But for some people, that clip is honestly really kind of too tight and uncomfortable, depending on, like, make nostril size and density. And so they put it on and it feels quite painful and uncomfortable for them. So first suggestion, do some adjustment, because like you can literally slide a little bit of paper towel. Like you can literally do things to kind of just adjust like how specifically uncomfortable just having that clip is. There's a few ways you can adjust the clip, right? And it's quite flexible. So for most people that feel uncomfortable, I just a little bit of paper towel, a little bit of tissue, a little bit of fabric. I usually just you know put a few things, just I try a couple things, and almost always I can make a tolerable level of tension for them. It is, I think, a little bit more difficult to tolerate for people to have two up your nose. If you've got like a deviated septum or any difficulty with like, breathing, like that can feel a little stressful. But I actually think that most of the time, if you're making sure it's not physically uncomfortable, and you maybe start with a couple shorter sessions, you can actually breathe around them just fine. And so there is is it just kind of uncomfortable, a little painful, and I don't like it? I think that one you can probably work through. Do I actually have like injury, like physical structural integrity problems? If you do, maybe there's a consideration of like, will the light actually have like enough radiation bounce effect at all? However, if you don't actually have like like occlusion or like physical protrusions blocking light radiance pattern, then I actually have had two people who just really had a hard time tolerating it. We just took like some surgical tape and we physically taped it right on their top lips, like right at the entrance, like maybe a millimeter in the nostril opening, right? We just taped it right there and let them sit there and did what we could. Now, here's what I say. I have no methodically sound pre-post collection of like, was that, how different was that than having it all the way in your nose? Like I have nothing that is not anecdata. Here's what I will tell you. As far as their symptom report, both of the people that I tried that with said that, because we did 10 hertz on both of them said that they noticed a little bit the relaxation effect of the 10 hertz, but they both noticed for sure the energizing effect of the 40 hertz. Do with that what you will. I don't think it's useless to try to put it right at the entrance of the nose and let it sit for a little while. But I don't know how much of a difference that makes so far as actual dosing and exposure and therapeutic effect.
Amazing. Thank you so much. So we have 4 more minutes to go. I can ask one question from Jenna. So the question is, many TBI patients have symptoms such as photosensitivity that may be related to brain hyperactivity. Yet they may also be they may have processing speed issues. Would you start with a 10 hertz treatment and then adding the 40 hertz or some other protocols? What is your recommendation?
Yeah, so with that population, we've seen benefits with the Nero Alpha and with the Nero Gamma. So yes, consideration in terms of their sensitivity would be an important deciding factor about whether you go with the 10 hertz and 40 hertz. What that individual suggested, which was starting with the 10 hertz and then moving to 40 hertz, may be a good way to kind of get them into it and slowly ease them into higher frequency stimulation. It's not the case with every TBI in a person with a TBI, because, for example, our study with the ex-athletes done by Utah University, they all had head injuries or multiple of these RHAE events, and they did okay. They didn't have issues with sensitivity to the stimulation. So it is worth trying the 40 hertz. And actually, in our upcoming TBI, like I said, we're going to pursue that medical licensing as a treatment for TBI. And in our upcoming trial that's planned, we're changing up the protocol a little bit. So we're actually starting with 10 minutes of that 10 hertz alpha stimulation, a 5-minute break, and then 10 minutes of the 40 hertz stimulation. So a lot of this is based on, first of all, we've seen that both alpha and gamma, we've seen good results. So why not combine them? I mean, you have the benefits of the wavelength of the near infrared light, and then you have the benefits of the pulse frequencies, right? So, and then if you remember the microtubule research I talked about earlier, so that 10 hertz again seems to be able to prime the brain for then maybe gamma stimulation or other treatments. And that's why we're now using this combination. So we'll learn more once that trial's done. But I think that starting with 10 hertz and going to 40 hertz is kind of what we're doing as well. But you might want to do like a day or, a few sessions of 10 hertz before and see how they do with that. And then go to the 40 hertz, and they may do totally fine with the 40 hertz. So you can use a combination at that point.
Perfect. Thank you. One other question was regarding senses of taste and smell, and if photobiomodulation can help with that. So I can answer that in terms of at least the COVID study that we ran. So we ran a COVID clinical trial. So we had the X Plus device. The LED was sitting on the thymus, and the other intranasal piece was there. So everyone had COVID at that time. And so you know that they were dealing with senses of smell and taste. And what we found at the end of that study, after analyzing all the results, was that the senses of taste and smell were statistically significantly better for those who actually use the active device. So yes, in short, photobiomodulation can help with that. I think I see that we do have a couple of other questions that we didn't get a chance to go to. Please send us emails. If it is research related, if it is NeuroPro related, if it is just a general affiliate program related, please keep in touch with us, send us emails, and let us informed. I would like to take this opportunity and thank our speakers, Jenna and Penny Jean, for this wonderful presentation. Austin, I would like to thank you for being a great co-host, and obviously, I would like to thank everyone on this webinar. It has been a great pleasure for all of us to have you here. Thank you. Have a good day.